Hello and welcome to our webinar on the impacts of COVID-19 on food security and long-term implications and adaptations. This is the fifth in a series of webinars aimed at cities and regions in the post-coronavirus era, initiating community conversations on what lessons we can learn from this crisis to create a more resilient and sustainable world. My name is Katie Phillips, and I am the Outreach Coordinator at the Center for Urban and Regional Analysis, otherwise known as CURA. I will be your host for this event. Please feel free to submit questions at any time during the webinar in the Q&A box. We will ask as many of your questions as we can in the last portion of the panel discussion, and if we do not get to your question, we apologize. If you have any additional questions following this event, please feel free to email me at phillips.1870@osu.edu. There will also be a short survey at the end of the webinar. If you have time, please feel free to provide your feedback. I'm going to kick it over to our moderator for the event, CURA's Director, Harvey Miller.
All right, thank you, Katie. And again, I'm going to join Katie and welcome you to our series here on cities and region in the post-coronavirus era. We'll be talking about food security in just a few moments. I also want to make you aware of our next webinar in this series, which will be Friday, October 23rd. And that webinar will be on the impact of COVID-19 on federal, state, and local budgets. And we have a really killer panel for this webinar. We have Megan Kilgore, who's the auditor for the City of Columbus. We have Kimberly Murnieks, I hope I pronounced that correctly, who's Director of the Office of Budget Management for the State of Ohio. And Jim Landers, who's an Associate Professor of Public Affairs here in the Glenn College. So that should be a really good panel. That's October 23rd at noon. Be sure to register for it. If you can't make it, we'll send you a link where you can watch it at your own leisure later on. So check out our events page for more information about our upcoming webinars and to register. cura.osu.edu, and also be sure to like us on Facebook and follow us on Twitter and Instagram and sign up for our newsletter at our website as well. That way you'll never miss any of these events or activities that we're bringing to you here at CURA. Okay, so now I'm going to introduce our panelists for today's webinar on food security in the post-coronavirus era. First, we'll start with Kip Curtis. Dr. Curtis specializes in environmental history and studies with a research and teaching foci on mining, environmental ideas, and food security systems here in the College of Arts and Sciences at The Ohio State University. Dr. Curtis is also principal investigator in a community-led food system intervention project in Mansfield, Ohio. And in addition, he's working with students and alumni to grow food on a demonstration urban microfarm built on top of a former parking lot on the Ohio State Mansfield campus. That's really good. Good thing to do with a parking lot, Kip. This will be a model small plot high yield microfarm that currently produces food for the campus cafeteria, the campus community, and for the Richland Grow Op Cooperative. Thanks for joining us today, Kip. Another panelist is Mary Rodriguez, and Dr. Rodriguez is an assistant professor of community leadership in the College of Food, Agriculture, and Environmental Science here at The Ohio State University. And Dr. Rodriguez works in addressing household food insecurity. She approaches her research by examining the role of women in the household and explores the interactions between the community social system and individuals' decision-making. Dr. Rodriguez mostly works in developing nations and in low socioeconomic status and low-income populations on the state side here in the United States. Thanks for joining us today, Mary. Brian Snyder is Executive Director of the Initiative for Food and Agricultural Transformation, also known as INFACT, here at The Ohio State University. Previously, Brian served as Executive Director of the Pennsylvania Association for Sustainable Agriculture, one of the leading sustainable agricultural organizations in the nation. And he also served at the William J. Gould Associates, which operates Gould Farm, a 700-acre sustainable farm and mental health treatment facility in Western Massachusetts. Thanks for joining us today, Brian. And finally, last but not least, is Lauren Vargo, and she is a research associate with the Ohio Produce Perks statewide evaluation at the Sweatland Center for Environmental Health at Case Western Reserve University in Cleveland, Ohio. She also works on the Fresh Link Ambassadors Project housed in the Prevention Research Center for Healthy Neighborhoods at Case Western. And previously, she was the Produce Perks program coordinator at the Ohio State University Extension Service in Cuyahoga County and has worked with farmers markets, local food access, and SNAP incentive programs in Cleveland for several years. And she's also a geographer with a BS in geography from Ohio University. And we love geographers here at Cura. Thank you for joining us today, Lauren. So I'll now ask the panelists to give some opening remarks, and we'll start with Mary, who will speak about the impacts of COVID on food security at the household level. Mary, please.
Sure, thanks, Harvey. So when we think about food security, we can think about it in a lot of different ways. My focus is primarily on the household level. So as you heard in my bio, I do a lot of work internationally, and some of the concepts that I bring or I investigate internationally, I can bring home to the United States and to communities like Columbus when looking at low-income, low SES households here in this area. So one of those concepts is household resilience. In the United States, we do a lot of work in looking at community resilience, but in international settings, we look at the household level. So I've brought that concept here to the United States to better understand what is the role of household resilience in the way that it relates to food security. When we talk about household resilience, we look at the capacity for a household to bounce back. This looks at a household's access and use of social safety nets, resources, support services, and other assets that they can leverage during crisis. For example, COVID-19. So we've seen that households here in the United States have faced a lot of difficulty. Examples of this has been loss in jobs or kids in online learning, which I know a lot of us are facing. This has presented challenges for childcare and presented difficulty to operate the household in the way that it was before COVID-19. There have been changes in job policies that have made it very difficult for primarily women to be able to engage in childcare responsibilities, household responsibilities, and job responsibilities. One of the examples that I heard most recently was changes in our public transportation and how that actually impacted members of the community on the south side here where I live to get to and from work because of COVID-19. All of these things really change the way that a family is able to make decisions about food and about all the other pieces of their household and how to take care of themselves. So when we look at household resilience, it gives us a picture to see how can a household leverage those assets or lean into support services or safety nets, and how does that impact then their food security? How can that then give them more access to the food that they need to for their personal well-being and the well-beings of their family?
Great, thank you. Lauren, let's hear some remarks about policy level responses for the needs of consumers and individuals, especially those receiving federal benefits. Can you speak to that?
Lauren, you're muted.
You're still muted, Lauren.
There we go. For some policy level responses, we did see a huge increase in the amount of SNAP being distributed. So since March, there was 6 million Americans that applied for SNAP benefits and that are now receiving them. There were also some other responses like pandemic EBT. So for families that were getting or had their children getting food at school, they now are receiving pandemic EBT so they can buy some food at farmers markets, grocery stores, any of the locations you can normally spend your SNAP. We also saw an increase in the amount of SNAP that recipients were getting. So the lowest amount before was about $16, $15, and they increased that by 30%. So people were getting $192 or more a month compared to 15. So that was a huge increase and a huge help to people that did need that assistance. And there also was one more change that for the first time, they were allowing SNAP sales to happen online. And that was at both Walmart and Amazon Pantry. So people are utilizing those opportunities to procure their foods in different ways.
Great. And just for our listeners who may not be familiar, what does SNAP stand for? I use that as well, so we should probably define that just to make sure everyone's clear in what it is.
Thanks for catching me on that. It's the Supplemental Nutrition Assistance Program. And just to address the work that I do as well, I lead the Ohio evaluation for the Produce Perks program, and that is the SNAP incentive program across Ohio. And it matches, so if a SNAP recipient comes to a farmer's market or a participating grocery store, they can match their SNAP dollars $1 for $1 up to $25. So, and then with their Produce Perks, they can spend that on locally grown fresh fruits and vegetables. So increasing access to healthy food.
Great, thank you very much. Okay, Brian, can you give us a national level perspective on what the implications are of COVID for our supply chains, our food supply chains?
Sure, very happy to. And for the purposes of this discussion, I'm going to suggest that everybody participate in sort of this this imagery that I'm going to suggest, and that is, think of the food system as a river. And so you could think of it as the food stream, the supply chain from farm to table. And think of that as a river that flows between those farms and goes through a number of different junctions on the way to your table. When that water flow is reduced in the river, we can see the rocks and the hazards that appear. And when that water flow increases, the rocks are still there, though we can't see them so easily. And I think you can see where I'm going with this, is that we have just experienced this with our supply chains, where the flow of food was interrupted. If there's an obstruction in that stream, like a dam, that means that we could see extreme indications of hazard below that dam because of the reduction in the flow of food. So with that image in mind, I want to say that there were really 3 levels of hazard that appeared during the pandemic, some of which were obvious and maybe we could have predicted, and others less so. The first level, I would say, are the interruptions in the normal flow of food, and these are the kinds of things that you all saw on the evening news and read about and maybe even experienced personally, where there were shortages and also surpluses in different points of the supply chain. And you know, it was somewhat horrifying for us to see mountains of vegetables in some cases having to be worked back into the land, or even animals, livestock, by the tens of thousands in some cases having to be destroyed because they were not flowing, that the food was not flowing in the normal manner. The biggest problem there is, of course, that the flow is diverted, that instead of food going directly to schools and to restaurants and other kinds of institutional venues, it was coming directly to our homes, or at least that's where it was supposed to be coming. And it couldn't get there easily. So we found that actually the system is fairly inflexible and can't quickly make that kind of an adjustment. The second layer of obstruction that appeared in the form of bottlenecks or dams, using the image that I suggested. These were bottlenecks in production, processing, distribution. Probably the ones that were heard about the most are processing plants, like meat packing plants in particular. In business, these are considered to be like points of constraint for the supply chain. And but even our grocery stores became points of constraint in terms of how the food could get to us. You know, we all heard about toilet paper shortages, for instance. And even though toilet paper is not a food, it is certainly part of the food system. And so it was an effect of how the food system was immediately impacted by COVID. But then the third impact, the third layer of impact that I want to mention here, and I hope we'll talk about more in the course of this webinar, are the effects on workers in those constraint points, because they have been extreme and they have not been they have not been equally distributed across the whole our whole society and across everybody that is interested in the food system. And I would say there are 4 factors that came into play there, and that is the proximity of workers working close to each other, and in some cases working closer than they did before. For instance, in poultry plants, some plants increased their line speed from, and think about these numbers, 140 birds per minute up to 175 birds per minute. Think about that, let that sink in. And the workers had to work more closely together in order to make that speed adjustment. Of course, poverty is a major factor. These are not highly paid workers. They lack benefits like healthcare. Diet is a big factor. It's widely agreed that the vast majority of deaths that occurred due to COVID had underlying metabolic disorders of one type or another. I saw some estimates as high as 80%. And then the big one in the case of these workers is immigration status. Just with farm workers alone, with migrant farm workers alone, 50% of them are undocumented. So if you think about it, they had a huge disincentive to even get tested or to come forward with symptoms, and also to seek any kind of treatment. And even the companies that employ them have a disincentive to provide treatment because of the fact that they're undocumented. So I'm just going to end this part and say that we should all be thinking about all of these structural issues. Think of the image I gave you of the river and the structure, the hazards that are under the water. All of the structural issues in the supply chains and the food system that have become clear to us now, that are still there, even as the flow of food resumes and need to be addressed. Thank you.
Good, thank you. And we certainly will be looking forward past this crisis during today's discussion. So Kip, can you finish off the opening remarks by telling us a bit about localized food production? You have some expertise there. What are you seeing?
Well, first of all, Harvey, I really want to thank you for allowing me to be a part of this panel. I feel like kind of the odd man out. I'm a historian and an environmental historian, which positions me towards all of this with a slightly different perspective. On the one hand, all of the things that Brian describes, and I love your metaphor of the river, I'm going to use that as well because it's perfect, are things that we environmental historians know happen repeatedly through the history of human civilization. Pandemics are not new. And in fact, we really are smart enough to be able to anticipate and react to them far better than we did in this set of circumstances. And so there are often the unexpected outcomes of things like elections that impact the way in which knowledge can be applied. And I think from a historical perspective, we're not dealing with a situation where we don't understand what's happening or why it's happening, and even that we couldn't have anticipated it, but rather that we are, I think, poised to make some really profound changes based on exactly what Brian so eloquently described as the hazards that are exposed by the lowering of this river. When I think about the river, so I got into this food system thing before COVID and wasn't thinking about COVID or anything like COVID. I was thinking about food flow like a river as well, but I was thinking about the fact that that river flows towards a gravity, and that gravity is capital, it's markets, it's dollars, it's so there's a relationship of, might we be able to think about creating a canal from this river into communities? And I was working on a local food system that was designed to do just that, was to think about how, really, I wasn't even thinking about food systems, even though the project I'm working on has all of the optics of a 21st century foodie sort of paradise. It is really a social justice project designed to flow food dollars into low opportunity communities and use the food system to do that. And we do that with these little sort of Goldilocks sites called microfarms that are small enough to produce an income but large enough for a single farmer to work. And we aggregate those farmers together into an old school cooperative so that they have enough food of market quality, of enough scale over a regular period of time to actually be competitors, to be gravity in the flow of food, and have that food flow down into that community. And so we're working on that project, and COVID hit and research stopped at the university, but my project did not stop. And so what we learned unexpectedly was that if you build a local food system that's based on this sort of smaller scale, the system itself has a resilience that can continue to sustain. So we have producers who, in the midst of this COVID crisis, in the midst of the kind of large scale food producer crises that Brian was describing among workers, are continuing to get fresh food dollars into their pockets and into their neighborhoods through this whole summer. So we kind of suddenly found out in the midst of this that this system has got a whole lot of resilience even amidst a crisis. And we think that as we emerge out of this, and you'll learn through the course of today, I'm kind of Pollyannish about this. I think it will happen faster than most people think. And I think we're going to be okay. And I think we survived the crisis remarkably well. But I think when we come out of it, we have some really concrete things to point to towards what I talked about at the beginning, which is we know enough. We know how to deal with pandemics. We're not going to stop pandemics, but we are going to be able to contain them better and more resiliently when they happen.
Okay, thank you. That's a good way to wrap up the opening comments with a forward-looking message. But before we start talking about the future, let's just talk about what's happening right now. Let's drill down a little more into that. So I want to hear from the panelists. What really was the most surprising thing about the impact of this pandemic on our food systems and, as a result, food security? Let me start with Mary first.
Sure. I think that one of the things, I don't know that it was necessarily surprising, but maybe just awakening, if I may, that how quickly and how deeply something like this could affect a low-income household. In my work with New American Populations here in the urban center of Columbus, it has been really interesting to hear about the challenges that they have faced in accessing food. So when everything went on lockdown, you know, we were many of us were encouraged to go get 2 weeks worth of food at the grocery store and, you know, stock up and have access to food at home. Well, when a family is really, if you will, eating hand to mouth, for lack of a better way to describe it, they don't have the ability, either monetarily or maybe through infrastructure, the capacity of a deep freezer or having access to proper refrigeration or adequate refrigeration to be able to keep healthy and nutritious foods in their households for even 2 weeks at a time. And so many of the times low-income households were, you know, they buy food as they can and as they're able. And so when COVID-19 hit, it was really alarming. I think when I would speak to our New American Population and just hear some of the things that they were having to do and having to leverage, like changing their diets a lot more towards things that could be kept in the household, like dry goods and things that maybe didn't have as high nutritional value, because they also panicked and were told you can't do what you were doing before to access food. And so I think that to me it was alarming to see how quickly and deeply this affected families back in March. I have seen a little bit of that shift back to normalcy, if you will, in the way that people are accessing food again. But I think that it brings up a really important perspective for policymakers and community support services to really be thinking about how to proactively prepare and help families that are receiving any kind of social net for situations like this that are completely unforeseen and challenge in ways that they may not have even been prepared to know to be that, you know, to how to address it. So I think for me, Not surprising necessarily, because it makes sense, but alarming, I would say.
Okay, thank you. How about you, Lauren? What have you seen among the communities you're working with? What's been the most surprising thing or perhaps alarming thing, if that's what you'd like to address?
Yeah, I was actually just laughing because I feel like we all work in food, so I don't know if anything would be particularly surprising to any of us that this happened, but one thing that shocked me is how quickly the inequalities in our food system were just put out on the surface for everyone to see. And that is in food access with lower income individuals, food distribution, as well as food workers. And all of that was brought to the forefront of the pandemic. And I think about prior to the pandemic, the news that I would read. You know, if I read the New York Times, and the only thing that I would ever see about food in there is if a new restaurant was doing something really innovative. And now I see updates on meat packing and processing plants. I see kind of stuff that Brian touched on, that food is being wasted and people are being really upset about it. So all of maybe the hidden parts of our food system that weren't very pretty came to the surface from the pandemic. Grocery store workers, restaurant, fast food, farm, meat processing workers are all now considered essential. That's something that is incredibly different that came from this, and yet they are still struggling, many people, to make a living wage. I also see myself, and I'm hearing it from people, that when you go shopping, you know, you see on canned goods or with other things like toilet paper, you can only buy 2 or 4 of these items. So, you know, having these limitations on ourselves, and also we're hearing that there has been a huge increase in the price that people are seeing for goods that they would normally get, produce as well as meat. So I think a lot of us were on this autopilot, just heading to the grocery store, assuming that, you know, everything was there, it just got there somehow. And now we've been a little awakened to the fact that there is an entire process that gets that food picked from the farm to where we pick it up at the grocery store. So people are realizing that there's a lot of hands in that process.
Okay, good. Thank you. Brian, from a systemic level, from a food systems level, what's, you know, the river ran out, as you said, we see the boulders and the dams and the obstacles. What's been the most surprising or alarming one?
Well, I'm going to stay on the theme of people, and particularly workers, and echo some of the things that Lauren said, but I'll try to highlight the things that I think indicate real systemic problems that maybe didn't occur to people before. So when you realize that such a huge proportion of the food system depends on immigrant workers, and in particular undocumented immigrant workers, and then you turn the channel and see all of the concern about illegal immigration and problems at the border and how people are treated there. I mean, there's cognitive dissonance there, and should be for everybody to realize that as a nation, we have this tremendous concern about people coming into the country, but as a nation, we literally can't even get our food unless undocumented workers are getting in the country. So that should be very alarming and surprising to everybody, that we need to fix that problem. And further down the chain, Lauren mentioned grocery store workers. Just an anecdote. The grocery store that I go to most frequently there in Columbus hires an awful lot of employees who have various kinds of disabilities. And I think that's a wonderful thing they do. I used to run a mental health program and would work to get people placed into jobs like that. But to realize now that they're essential workers, and in many cases badly treated by the customers that were coming in. You know, customers that wanted more than 1 pack of toilet paper, or customers that didn't want to wear a mask. Well, you know, an employee of a grocery store has to try to enforce that rule. I think that's another point of systemic problem, and should be should cause cognitive dissonance for us, and I would call it a surprising feature that people that we took for granted all through the food chain really are essential now, and we need to figure out some of the issues that they face and will be facing for many years to come.
Good, thank you. Kip, any surprises when it comes to localized food production, either currently or you already hinted that you'll see some changes going forward. So what's the big surprise there?
Well, as I said before, our surprise locally on the system that we're working on is that if you have a decentralized system, it's more resilient in these types of circumstances, which, you know, we hadn't thought about the problem, but once the problem arose, it was there. I want to muse just a little bit about what I saw in my supermarkets from a foodie perspective, and I think it's really interesting in some ways as well. So where I intersect with food personally and locally is in a middle class supermarket that's part of a suburban neighborhood of middle class Americans. And what they grabbed when they thought there was a crisis was bread, fresh vegetables, and ground beef. And I mean, you walked around the supermarket and you could walk down one aisle and it was filled with food. And then you walked into the bread aisle and it was empty. And it was sort of puzzling to me what exactly. So it suggested to me that my community is not eating healthy, and that it has a very, very limited imagination about what it does in terms of its own home preparation of food. And I think that actually exposes a larger weakness in our food system when you talk about the gravity part of the food system, which is that local demand. Ultimately, we can rail about what should be, but consumers go out and make the purchases and make those decisions. And so we're seeing that. Those are the rocky shoals being exposed in my supermarket, which is that we've got a wealthy group of food purchasers who really have no imagination about what they're doing with food itself. And we need to work on that because we need them to be buying into these alternative food systems and thinking more about local food, local production in sort of more healthy ways. And so I just remember I walked down the bread aisle and it was empty, and then I walked down the next aisle and the flour and the yeast was full, right? This was the first kind of encounter there. So there's a loss of knowledge of food production, food literacy, you might call it, that sits at the heart of the American consumer culture that helps to perpetuate all of the kinds of human and labor crises that everyone else has described here.
Right. Okay, good. So thanks for those comments. So let's drill down on the idea of risks and weaknesses that COVID has exposed in our food system, because that's really the big lessons we want to get out of this going forward, to learn from this pandemic and as everyone said, what it's exposed. So maybe Lauren, you can start and talk about how different social groups have been affected, and what should we do moving forward to help these different social groups.
Yeah, absolutely. So I'll read off my notes a bit for this so I don't mess up any of my statistics. But based on food insecurity census data, prior to the pandemic, we were seeing that 21% of Black households, 16% of Latino households, and 8% of white households were reporting that they had some level of food insecurity. All of which groups had higher food insecurity if there were children in the household. Fast forward to life during the pandemic, beginning in March 2020. Based on data from the Census Household Pulse Survey, we are now seeing that both Black and Latino household food insecurity has risen about 15%. And food insecurity among white households has risen 10%. Again, those are both higher with children in the household, which also plays into pandemic EBT and some other factors that the federal government was trying to aid those families and households in getting food for everyone that lives there. And even before the pandemic, and really looking at the past 10, 15 years, food insecurity in America has been decreasing slightly, but African Americans have been making up a greater percentage of the food insecure households. As a personal plug, we are also conducting a Case Western data collection to understand better how SNAP recipients and their shopping habits have changed since March 2020. Our data collection does continue through October, but we're hoping to hear kind of after that come up with some, or get a better understanding of how people are using their SNAP dollars, if they're using the Produce Perks program, so other incentives that are available to them. But we are hearing that people are spending their money or shopping at less stores in general, so a less variety of stores like grocery stores, corner stores, dollar stores, just less, so not wanting to go in as many places. People are reporting, as I said earlier, that the food prices have increased, but we are seeing that people are purchasing more fruits and vegetables to cook and eat at home. So there are some good things that people are doing while they're stuck at home.
Oh, good. And you'll be publishing that report on this, these changes in food habits. Is that correct?
Yep.
Okay, we'll look forward to that. Maybe you could share it with us and we can push it out on our website. So let's talk a bit about the role of school and school meals, because schools have closed, and that must add this food security, among families that depend upon that for their children. Have you looked at that, Mary?
Yeah, so just in, again, the New American population, which is where I situate my research here in Columbus, this was actually a really big impact on that household, especially when they were relying anywhere from 1 to 2 meals a day for youth at the school system. So something that we saw was that community response was quicker to address this particular issue than was government support or social services support in this area. So one of the things that we saw was that community members saw that there was a need to make sure that youth were getting access to at least 1 meal during the day that they usually would rely on getting from the school. And so we did see community response coming together and trying to put together lunches that they would distribute in perhaps the apartment complexes where our New Americans live, or I also heard about, I know that there have been efforts to use school bus routes to also deliver food to certain areas. Here on the south side where I live, just walking through the neighborhood, there were several households that had, if you need a lunch, take a lunch. And so they would make packed lunches and they would distribute, they would just have them there. And I often saw kids coming to the table and grabbing a sack lunch and taking that with them. So it was incredibly difficult for households, I think, that when they knew that they could rely on these 1 or 2 meals a day for their kids, figuring out then how do we leverage what we've got at home and sometimes spread ourselves even thinner in order to meet those nutritional needs and food needs of their youth during this time. So I think that one of the things that I can just kind of think about where we go from here is, I think, recognizing that schools play a tremendous asset for low-income, low SES households, other than just educating their youth. They also provide safe spaces for their youth to engage. They also provide a lot of support services to the kids, but especially when it comes to food, recognizing that when we have a change or when we have a crisis like this, how can we ensure that if kids are getting free and reduced lunches or the breakfast, that there is some sort of a mechanism in place that can also address some of the things that Brian was talking about. How can we continue to get that food moving through the school system, in terms of that river, if you will, to continue to then help and benefit the household and not stretch them so thin during times like this.
Good, thank you. So let's talk a little bit about that, about the food system and redundancy. So Kip talked a bit about localized production. I want to get back to that in just a few minutes, but I want to turn it to Brian now and say, is part of the solution to build greater redundancy in our food systems, and how do we do that based on what we've learned so far from the COVID?
Yeah, redundancy is an excellent word to use, although sometimes it has negative connotations. In this case, it has very positive ones. So let me explain a little bit. The first thing I want to say is there is no silver bullet solution. So even though I am also an advocate for local food systems, the real answer to the problems we're seeing now are widely diverse food systems and many different channels for food to flow through. So if you stay with the image of water being backed up behind a dam, you want many ways for that water to flow through. It'll come through the dam at some pace, but you want, Kip mentioned having a canal. You might need locks to move ships through that passage. We've seen fish ladders so that even fish can go through a barrier like that. So think about all of those different diverse ways that food could flow. And then I'll give you another image. Think about a power outage in a neighborhood. Maybe a tree blows down in a storm. What we want is for that outage to be very temporary, because we want the system to be able to reroute that power another way and get it to your house a different way, which usually can be done within an hour or so in most cases. So what would be the equivalent of that? We need redundancy, and so this is the definition. We need many different ways for that food to flow. You know, the food system right now, we acknowledge, is not working for many consumers who are food insecure, but it also is not working for many farmers who have struggled for years to make ends meet. So if it's not working for people at both ends of the supply chain, we have to think about how to improve all of that flow in the middle. I have a fly landing on my camera. That's why. But so you know, we need diversified systems to improve that flow of food through the supply chain, so it works better for farmers and consumers.
Now, Kip, can you now talk about localized production? What's the role of urban agriculture in mitigating food insecurity, and especially in the future with, you know, this isn't the last pandemic we're going to see, of course, you know that as an historian. So tell us about urban agriculture and how we can use that to create a more resilient food system in the face of future pandemics.
Yeah, not just pandemics. I mean, you know, for those of us who know our science and our earth science, climate change is real, and most of our cities are in striking distance. And so there's going to be a lot of things that we deal with in the next 50 to 100 years that are going to require resiliency and a certain nimbleness in being able to respond to circumstances. I wanted to quickly throw a comment in on the schools and food question, where we come in trying to work with schools. We have encountered there's a challenge in that food system, in that because of there's no preparation taking place at schools, because there's no cost effectiveness to that, and the quality of the food that is coming through the free food system is simply not the best, because quality food flows towards the best dollars. It's a market system, and it's really difficult to overcome those tendencies. So we're trying to build something that says we accept those tendencies and would still like to solve this problem. And my goal was to create producers who would produce enough food in this system to compete for the market. But the biggest question was, you know, would we have sufficient market? Would we be able to sell all of this food? And COVID came at exactly the right time, because about 1,000 of those suburbanites who live in and amongst me, instead of going and buying out all the bread and the hamburger, subscribed to a local food service here that provides food boxes, that was our primary buyer, whom we thought we were going to outgrow, who instead bought everything that we produced at a premium price through this crisis. And so the top dollar for the best vegetables have gone into the north end of Mansfield. At the same time, dollars otherwise are flowing elsewhere. And so we got more dollars into the places where they were needed during this crisis. And it's household dollars that gives that household the choice to go and buy the food. And they tend to make that households make better choices when they have dollars with which to work with. But then we had this other surprising outcome. So first, this demand was a surprise for us. And I guess anybody who knows anything about agriculture would know this. About 1/3 of our production is not marketable. It can't go into those boxes. It's got a little blemish. It's not the right color, et cetera. Almost 1/3. So we're producing 2 tons of vegetables a month. 1 ton of those vegetables are nutritious and healthy and are now being distributed right out into the community around these microfarms as well, either at an extremely low price or for free and right out into those food kitchens. And so the surplus, which out on a factory farm operation would be plowed right back into the soil because there's nothing economical to do with it, becomes nutrition in the bellies in these food insecure food deserts in Mansfield. And we really didn't anticipate any of those. We just wanted to make money for our producers. But we think we've leveraged the market system in a way that has these other really, really cool, resilient effects.
Okay, thank you. Those were good answers from all the panelists. Now I want to turn it over to Katie, who will ask some questions from the audience.
So we have some really great questions, and please continue to ask them as we go through some of these that have already been asked. I'm going to start out with a little bit of a long one, but basically what they're looking for is, can you guys talk a little bit more about how customers or consumers are not really aware of the logistics of getting food from the farm to the market and actual harvesting and transportation problems with getting that food from the farm to the market?
Well, I might jump in there as a person that's worked for a couple decades with the farming community. It's always frustrating to farmers that consumers don't really understand what is involved in getting food produced and to market. And like Kip mentioned, sometimes the food doesn't look exactly the way you think it should, and often that gets wasted. So this is one of those things that's true anywhere you go in the world, is that consumers are further from the sources of their food. They understand them less, and they don't behave in a way that would suggest that they care that much, by and large, about how the food gets there. But that has changed. And I truly hope that what consumers are learning through this pandemic about the supply chain is going to affect their buying behavior long term. And so I'll echo what Kip said, that I don't think that there's a chance that all those people that are buying food boxes from local sources, that that they're not all going to go back to their prior habits. Some of them will. But this is a problem that we have everywhere, and that we need more education for the public on, so that they understand what it takes, including the fact that it requires migrant workers and people with disabilities working in grocery stores, and these things, these factors are things that people need to understand better than they do. That's for sure.
How about you, Lauren or Mary?
Yeah.
Please, Lauren. Yeah.
Thanks, Brian, for bringing up the fact that not only valuing our food, but valuing all the people that are involved in it. I will say, from my point of view, I have heard of, there's more of an influx of people kind of coming to farmers markets or using CSAs, as Kip mentioned, the kind of prepackaged boxes. And I think it does make sense in that when you do think about your food, you're thinking, how many people are touching this? If we're coming at it from a safety COVID perspective, what's going to be less hands in the bucket? And to my mind, and I know that there's some people out there too, it's farmers markets or those types of models where it's directly from the farm to the consumer. So knowing the person or seeing the person with your own eyes that is picking it. And also farmers markets have really adapted to this time. They've come up with pre-order kind of models where you can pick out exactly what you want. The farmer can say, this is what I have this week, and you can order that online. There's drive-through models. So I think the adaptations are happening on both sides, and hopefully people will continue to be curious and want to learn more and want to continue to cook at home.
Want to add anything, Mary, before Katie moves on to the next question?
Sure. Just kind of just to add about how COVID-19 has also impacted the workers in our food system. One of the things that we saw was the outbreaks that were happening in meat packaging plants, and how that really stalled some of the trickle down of meat from there to the consumer. One of the things that we recognize as researchers, and one of the questions that was posed in the chat, was about what is our role as an institution to help address this situation and help address different parts of the breaking down of our food system. Well, I may not necessarily work in agricultural production, but what I do have an expertise is in behavior change and understanding how people change, how people adopt technologies in the agricultural setting. And so one of the things that my expertise was brought into was, how can we increase adoption or use of PPE in the meat packaging plants, when that may be already a part of something they're supposed to do, but it might not be a part of their culture. And so researchers actually leverage my expertise that I apply in a completely different area to help address a problem that was very important, not only for the well-being of the human, for which we were trying to see how can we create a campaign, if you will, or a very targeted approach to getting people to engage in this particular behavior, but also because it did, at the end of the day, impact the social system, the foods, I'm always thinking the social system, the food system itself. So, that's just to say, when our jobs as faculty and as researchers at an institution like Ohio State, we have so much intellectual capacity that we need to be creative about how we leverage that intellectual capacity in different ways. And that's just an example of how my expertise was brought in, and it doesn't sound like it fits, but it actually does, and it impacts our food system at large.
Thank you. Next question. What adjustments with food availability and food operations do you think will last even once the pandemic is over, especially considering many flaws were brought to light?
Anyone?
I'll take it.
Okay, I'll just go quick, Kip, and say one of the things that we haven't mentioned yet at all is the fact that many more people are growing vegetables in their own yards. If you were trying to buy plants and seeds this spring, you were probably out of luck because everything sold out everywhere very quickly. So I'm guessing that is not going to change, that people are going to start growing some of their own food more often. Yep.
And now we have far more tomatoes than we know what to do with here in the middle. That's what canning is for. Sorry, remind me of the question, Harvey.
Katie?
Katie, sorry.
It's okay. Once I find it. Here we go. What adjustments with food availability and food operations do you think?
Yeah. Okay, so what do we think will stick? Yeah, and one, I'm not supposed to prognosticate. I'm a historian, and so by nature, I look backwards rather than forwards. So take this with that grain of salt. But what we have seen over the last 50 years is a profound shift in the way in which we understand our roles as consumers and our place in the marketplace. And food is this really, really tricky, tangled commodity that's both a set of nutrients that we all require daily and enormous cultural things in all sorts of ways. And so figuring out how to weave it into what I think is a growing global market is part of what I think we're dealing with here and watching happen. And I think that Brian is right, that there aren't simple questions or simple outcomes. There are some things which we must, and it's almost a moral imperative that we do at scale, because that foundational stuff needs to be in people's bellies, and the economies of scale we can achieve for it make sense, and we can deal with the environmental impacts that it has. But most of the stuff we're dealing with, the specialty crops, ought not come from more than 50 miles away from where you are. And I think we're moving in a direction where we're starting to right size parts of the market and find new alternatives. And so I didn't invent urban agriculture. It emerged 20 years ago. I just happened to jump onto that train and think about a way of advancing it towards more productive farming ultimately. But that decentralization in the places where it belongs puts our food system in a place where it can achieve all of the things that I think the other panelists have pointed out so well it doesn't achieve, which is justice, which is that we've got an abundance of food and we've got hungry bellies. We've got people living well off that food, and we've got others being exposed to the toxins because of its growth. There are these inequities that have to be addressed. But I think we are, and this is my Pollyanna coming out, I think we are on a trajectory towards more justice in the food system and more right sizing in the food system. And that what we'll see is that this pandemic was a ratcheting up that advanced us quicker than we thought by exposing the shoals and also exposing some of the alternatives. And that they, whether or not they tomorrow or next year, they seem like they've caught on, they're here already and they're underway and they're moving quickly.
Thank you. Next question. How can food pantries aid in the food security issues while still thinking of COVID-19 and public health? Typically, donated food has been in contact with a lot of people.
I think I'll take a stab at this one, and I'm not a public health expert at all, but I think that seeing what the CDC is saying about how this particular virus lives on surfaces and how it engages with surfaces, I think is really important to consider, in how we see COVID-19 actually spreading through contact of goods. But I also think that food pantries were given a lot of produce and a lot of things that weren't moving through the groceries. And food pantries do not have the capacity to hold these products for long periods of time. And so getting these out to the communities was really, really important, and making sure that it was in a timely manner and in a way that made sure that people were safe as they came to actually engage with the food pantry itself to be able to take their stuff. So I don't know if I'm answering that question necessarily directly, but I think that when we think of food security, we can also think of the types of food that was actually flowing through pantries at this time. And hopefully it did give households the opportunity to get more access to fresh fruits and vegetables, because they weren't moving through the grocery stores, and that was a lot of what was coming into the pantry during this time. So when we talk about food security, we also talk about nutritional security, and how the body utilizes different types of food. So I think that is actually a positive thing in terms of food security. Yeah, just some thoughts there, just some musings. I'm not sure if I answered that directly.
Thank you. This might be a quick one. Have there been talks about allowing participants to use their SNAP dollars online at other locations besides Amazon and Walmart? Will there be expansion to more places in the future?
I can touch on this by saying I am not sure. Kind of a transition to offering SNAP online has been in the works for a very long time. And it was one of those that when this happened, kind of all the red tape that was covering up the process got cut away very quickly. And I do think that there are some kinks that are being worked out. I know with people that I've spoken with in our surveys, there's not a ton of people that are utilizing them. And some of the responses that we've heard as to why they're not is that it's not always the most simple process, or they don't have access to internet long enough or stable to actually do an online ordering. So they're choosing to still do kind of the typical method of going to the grocery store, driving there, whatnot. So I think that there's definitely room for growth, but people like to shop also at local places as well, places that are comfortable. So it would be important to offer it at multiple different places.
Okay, we're just about out of time. So what I'm going to ask now is for all four panelists to give us just a quick take-home message that they'd like to convey to the audience. 20 seconds max. Mary, would you like to start?
20-second takeaway? Sure.
No pressure.
Okay. I think just thinking about the food system, definitely keeping the consumer in mind, and seeing how a crisis like this that was very unexpected has really long fingers, and it can touch households in a lot of different ways when it comes to food security. And I think just always remembering that policy is really important in supporting our low-income, low SES households, and especially our new Americans, and making sure that we are cognizant of the challenges that they face in normal times and being ready to support them in times of crisis.
Good, thank you, and thank you for your participation today. Lauren, what's your take-home message?
My take-home message is that I hope that people continue to question where their food comes from, to cook at home, and also to be more understanding of these federal programs and why they're here. A lot of people are experiencing unemployment for the first time, uncertainty in their life, and there are people that are living with this on a day-to-day basis. And so, you know, when you go to the grocery store, if you see there's a little WIC sticker on it, know that maybe you could just take the item next to it, like the other peanut butter. Save those things for the people that are using those resources and need the programs.
Thank you, and thank you for participating today, Lauren. Brian, 20-second take-home.
Yeah, well, I'll say that I'm very optimistic that the current situation will lead to more widely diverse food systems and food streams as I've described them here. But let me just say to everybody that as we consider policies for the future, that we always have to ask the question about how it works for both farmers and consumers. We have to think about both ends of the supply chain simultaneously, because that's the only solution that will last.
Thanks, Brian, and thanks for participating in the panel today. Kip, you have the final word.
Oh, fantastic. Well, so I would say, you know, speaking from a historical perspective, that crises like these have a tendency to expose these seams and these weaknesses. And I grew up, I came of age in the environmental movement in the 1970s when, according to the predictions then, none of us should be here doing any of the things that we're doing because we were going to be out of everything by the year 2000. And people changed what they did. And I think that we are kind of in another moment like that, where we're able to kind of expose these things and talk about them publicly. And that has results. Human beings are remarkable in their ability to absorb knowledge and respond to it. We are a resilient species if ever there was one. So I am hopeful as heck about all of this.
Great ending for our panel today. Thank you very much, Kip, and thank you to the rest of the panelists. And again, cura.osu.edu to find out about our events and activities. And we'll see you on October 23rd to talk about the impact of COVID on state and local budgets. Take care, everyone. Be safe and be healthy.